is about rectosigmoid growth, spinal cord, here is the case of the today class. Here you can see spinal cord edema, spinal cord tumor, peripheral nerve cell tumor. If you are a radiographer, you don't know that much knowledge about tumor. You just know it's a tumor or it's a abscess. Or when you see the plain scan, you will find out you need, for the scan, you need contrast. Or here is the next topic of the day. It's hepatic abscess. Here you can see in this liver there is a large collection along with the air in this area, right liver lobe. Also we have MRI of this patient. Here you can see in MRI we will differentiate properly whether it is fluid or it's air or there is some type of cellular mass tissue. So next case is about rectosigmoid growth. Here you can see in T2 image the muscle looks hypo. In this area you can see the lesion of this growth in T2 image. Today we start with hepatic abscess. Here is the case. If you see the plain image, that type of case you will identify it in ultrasound report, previous ultrasound report. So it's more easy to identify that type of large tumor in patient. So it will be just, if there is a hepatic tumor or a liver as well, it's need triphasic in CT and dynamic in MRI. So it's a plain scan of the patient. Here you can see a little bit of information in plain scan. If there is a fluid, in X-ray you will find out erect abdomen. It's also mean in erect abdomen we will see the water level of the cyst or whether it is the collection in this abdomen. So in erect position we will see the level of the fluid. So here you can see it will show the collection level. Here is the level of fluid. It's straight line. You will find out here is a straight line. So we jump out to the angios phase. It's not like a tumor structure just because in tumor arterial phase is enhance the area. And here you can see the portal phase. You will see the in CT the portal phase is more important, just because in portal phase you will see the infected area of the abscess. Here you can see the area of the abscess properly, which look like this in portal phase. So that's why we will do triphasic if there is a liver abscess or liver tumor or something questionable in liver. Here you can see in venous phase. In venous phase, the lesion was properly showing. So in MRI, we'll see the everything in plain scan. That's why the MRI scan is advised. Just because if there is a high level of creatinine, patient don't have that much capable of CT contrast, so that time the doctor advised to plain MRI. In plain MRI, lots of information was seen in plain MRI. Here you can see the fluid. यहाँ में अच्छे से दिखाई देता है, यहाँ में अच्छे से दिखाई देता है कि जो एरिया में फ्लूइड है वो अच्छे से एक लेवल होके आता है. इसी वजह से एक्सरे का जो एब्डोमेन इरेक्ट एक्सरे किया जाता है वो इसलिए देखा जाता है कि जो भी सिस्ट या जो भी कलेक्शन है उसका एक्चुअल एरिया कौन सा है वो एब्डोमेन इरेक्ट में पता चलता है, सुपाइन एब्डोमेन में नहीं पता चलता है. इसीलिए वो इरेक्ट एब्डोमेन किया जाता है. और इसका जो T2FS, ये T2FS सीक्वेंस है, यहाँ में देखने से जो इन्फेक्टेड सेल है वो यहाँ में ब्राइट होके आता है. T2 में उतना इन्फॉर्मेशन इस पॉइंट में नहीं आता है, लेकिन इस तीर में जो इन्फेक्टेड सेल है वो हमें हाइपर सिग्नल लिखा के दिखाता है. जो एरिया है एब्सिस का वो फ्लूइड तो सेम ही है, सब में ब्राइट दिखाई देता है. और जो सीटी है वो सीटी का एक बार ओवरव्यू दिखा देते हैं. वेनस फेस को 3D कर लेते हैं. Today morning I will start a class about basics of MRI brain. There is a loss of audience. Right now I don't have find any audience. It's because my students are sleeping maybe. Here you can see the corneal image of this abdominal abscess. You will find out the fluid for the gravity fluid was posteriorly showing in this abscess just for the gravity, or there is a air in this abscess just because maybe patient have some type of procedure in this collection, some type of pigtail or some type of drain, so that the air was showing in this area. So I just briefly describe how to plan this scan. You have to, first of all, you have to plan the plane scan, whole abdomen included. After that, if there is a liver abscess, we plan for triphasic. The first phase was uh, starting for the liver to the bifurcation. Here is a bifurcation in this area. First scan area was that much for the triphagic liver. After that, the portal phase was plain. The portal phase was starting from the liver and end to the liver. You just select that much FOV for the portal phase. After that, the venous phase was like include full abdomen. Venous phase was include full abdomen. And after that, you can plan a delayed scan just because some type of tumor have wash out. Need to see whether it is wash out the contrast or the contrast is going through the abscess area, so it's needed a delayed scan. The delayed scan only include bladder, liver, starting from liver to end to bladder. That's all. And here you can see the liver is totally infected in this patient. We identified there was a fluid or not in sagittal and axial image. Here is a collection. Is it fluid or there is? It's mostly fluid or ascites for the liver abscess. Also in mesenteric collection, also here you can see the fluid like structure in this area. That's all for this. We jump back to the MRI sequence of this same case. Here you can see this is a T2 image. In T2 the fluid was bright, so we find out the collection also fluid, so it's in my place. Here is a यहाँ पे बारिश दे रहा है, so इसी वजह से बहुत सारा साउंड आ रहा है. This is a T2 sequence of the patient. This is also the corneal image of the T2. So that's all for this patient. Here you can see the diffusion image or every type of unknown lesion. When we scroll the sequence, here you can see the sigmoid colon. Here you can see the sigmoid colon. It's look like this going through the rectum, Here you can see the area of lesion in sigmoid colon. In T2, the large intestine is look like this in normal. There is no any wall thickening in this area, and here you can see the large portion of the rain happening in my place. Here you can see in this area it's large amount of growth in this area of sigmoid colon. In T2, the muscle will see the collection in this area along with the lesion of sigmoid colon. So sigmoid colon. So here you can see the collection of this area. We jump out to the axial just because whether it is normal or it's abnormal, the T sequence will be so hyper. It means it's like some type of tumor cell. So it's identified whatever it is. Then the sigmoid colon will include everything in this axial. We see that there is no lesion above the level of S1, S2, but it means we find out in sagittal image the lesion ended here, so we bring little bit up for the first of all sagittal T2 steer in sagittal. After that we goes to cornea. You will find out there is. I will show you the corneal image for better understanding. It's totally compressed the vertebra. We will look in steer image. Here you can see the lesion was completely blocked the cervical, the spinal cord, completely blocked the spinal cord. Here is the axial. So sorry. Here is the axial of the find out. Hey everyone, just comment me if you have any type of question or what is your background. In this axial image, here you can see the cord was compressed by the tumor. In this level the tumor is not that much enlarged, but we follow the sequence. You can see in axial image we will find out how much area will compressed for the tumor. You will see in this area there is a narrow of part for the spinal cord, and every lesion, every area was compressed by the tumor. So if you have find that type of lesion, you will planning look like that. You will plan a continuous axial T2 axial. Plan a continuous series of T2 axial. Here you can see we will starting from the normal area of the spinal cord. After that we ended in the normal area of the spinal cord and in there. So if you see, there is a edema of spinal cord in this level, so that we need a more area cover for the plan. Here you can see the edema like area in this spinal cord in midline. I don't know, it's a edema for the compression of the tumor. Here you can see in this level there is a edema. So we'll find out lots of information for this patient. Some type of tumor have in edema in spinal cord. It's look like this in T sequence. In T2 axial, we just see the area of this lesion. It's involving in this area. So if you see the diffusion image, we will find out the actual involving area in this tumor. Here you can see the lesion was that much in the middle of the spinal cord. After that it's enlarged that much, so it's the most in STIR we will find out more details other than the T2 or T1, just because STIR has higher signal, or it's also suppress the fat, so that if there is a lesion, it's properly visualized in STIR. You can differentiate the area of the tumor in plain scan with the STIR. You can see the narrowing pass through, and after this area will totally involve by the tumor. So we can plan a brain axial sequence for this patient also, just because we will see there is any type of abnormality in this patient in brain. After that we will take a whole spine of this patient, just because we don't know in other area of the spinal cord was affected for this tumor. So we take a whole spine sequence. Here you can see in contrast, this is a T1FS sequence. Here you can see the area of the lesion was properly visualized. And it's the case is the most rare case I show you in this video. So we try to in axial we find out the more detail other than the any sequence like sagittal or coronal, just because mostly we scroll axial image. Here you can see the area of this lesion properly. It's involved the vertebral artery also. The vertebral artery was compressed by the tumor. Here you can see the vertebral artery was. I will show the actual image of this patient. There is a okay. Here you can see this one, the left vertebral artery, and this one the right vertebral artery. Here is the right vertebral artery. If you scroll into this, you can see the artery was totally dilated in this area. It's totally dilated for the tumor. So you can see the artery was like totally narrowed in this area, and we find out the left-sided vertebral artery also compressed by the tumor. Here you can see the narrowing point of the left vertebral artery. After that so it's the case. If you find that type of case, so share with me in my WhatsApp or Telegram channel. We will discuss about every cases we found. If you see that type of case in your hospital, you just share with me. Here you can see we plan the axial scan, include everything, just because there is sometimes we don't find the abnormality in cord just because it's look like different. So in this case also you see the cervical spine cord. Here you can see the enhancement in this area, look like there is a enhancement in this area. So it's different to identify when you can see different type of lesion in this cord. So it's totally different to identify it's normal or not. So it's more important sometime. So we can take every expected area of the lesion. So we find out in sagittal the line was ended in here, so we plan everything in this case. Hey everyone, comment if you have any type of question, and whether you are from a medical background or you are from a normal people, just share your opinion. It's a more critical tumor in cervical spine. The tumor was compressed the spinal cord so that the patient unable to move the limb, or there is a paralysis situation happen for this type of tumor, just because it's compressed the nerves control everything in our body. So that type of tumor is more severe. Also, if you have any type of question, just comment me. I will try to answer your queries. Here you can see this is the pituitary. Pituitary was, if there is a lesion in pituitary, in dynamic scan we find out hypodense area of in pituitary. So if there is a tumor, we will see the tumor in pituitary hypo. In prostate also, in prostate if there is any type of tumor, so it's showing hypo. This is the 3D sequence of T1FS. Here you can see every thing in this patient in this sequence. We take brain just because if there is a lesion is in brain, it's also needful to know. Just because we see multiple lesion in any patient, it means metastatic or what is the stage of the tumor. So it's identified if we found different lesion in different type of body, so that the scan was important. Hey brother, just inform me if you have any type of query. I will try to answer. Also here you can see the lumbar spine of this patient was it's a lumbar spine MRI. I try to share the video, but I don't know the proper diagnosis of this patient. Here you can see in T2 image the bone normally look like this, but in this area you can see there is a little gray soft tissue like area in this lesion, little bit of edema. So next we see the T1. In T1, in any type of vertebra or bone, you will see the grayish lesion. It means there is a infection in this bone, or there is a post-injury edema like that. So it's more important if you see the type of area in T1. It's a STEER image. Instead we find out if there is a hypodense lesion in STEER, we need to add a diffusion. Just because STEER was showing hyper, if there is any type of infection, so we take a DWI for this patient. Here you can see in DWI the lesion was enhanced. I don't know the diagnosis, so I just show the every plane sequence for the planning or preparation if you have that type of patient. So here you can see the axial of the vertebra. Sorry, I will show you the Okay, today class is ended here. We Describe this patient tomorrow. You will see in T2. The lesion is look like this. Thanks for watching. Today class is ended here. We'll meet you next class.